have some interesting things to show you. I hope you'll all enjoy it. And also some new things for you to learn. People are still joining. We'll just get going in just a few minutes. One more minute and we're on our way. All right, folks. Let's start this up. And let me share with you all this new information. Some of it is new, some of it you've heard before. So as you know, I've published over 100 studies. I've lectured at several medical schools. I have chapters in medical textbooks. And more importantly, I've helped well over 17,000 patients. It keeps going because I still work and continue to work. So in this next slide, I want to show you what I was taught in medical school. In God we trust. All others must show data, medical evidence. So if you use a lab and you say, wow, that's a really good test, I like it because it says it does this and that and the other. Does that lab have any published studies on that? Or is that just slick advertisement and salesmanship and marketing? So be aware of those things, people. If you have knowledge, let others light their candles with it. And that's what I'm trying to do, help you understand. Sir Winston, I can't claim that because it's Sir Winston Churchill said that many years ago. And Leo Tolstoy, author of War and Peace and other great works, said, wrong does not cease to be wrong because the majority believe in it. I know of some healthcare practitioners that go to many different conferences. They hear this speaker and that speaker and the other speaker, and they believe what these speakers say. You need to go and ask for medical evidence. Show the data, the proof, not just your opinion. I'm here to educate. I'm not making money. You can go to my website, andrewcampbellmd.com. There is nothing for sale. Okay? And there's no discounts this week or anything. I do not sell. I sell if I teach. I give information freely. And this is just the medical advice disclaimer that I have to put on. This is what an attendee, I gave a lecture at A4M in Las Vegas in December 2024, last month. As you all know, A4M is a very popular conference, and it's a conference where about 7,000 to 8,000 attendees go. So they have to do it in Las Vegas because Las Vegas is the only venue where there's enough rooms for all those people and there's enough halls to put all those people in. So he wrote me, very, very nice doctor. I'm simply blown away with your knowledge base. After hearing you at A4M, I dove into your videos, and I wish I'd met you years ago after getting sucked into the shoemaker Nathan vortex. At least going forward with your direction, I will be able to truly help my complicated patients, and I thank you very much for that. Yes, you will, because that's what I saw for more than 30 years. I get this question a lot. Nitric oxide, when do you use it? Who do you give it to? Patients with neurodegenerative disorders like Alzheimer's, Parkinson's, ALS, which is also amyotrophic lateral sclerosis, which is also known as Lou Gehrig's disease, ataxia, and Huntington's disease. So that's when you use nitric oxide. And the nitric oxide I recommend to you is the one that I've used for years and years and years. It's Dr. Nathan Bryan helped develop it. And it's N101, not 01, N101. Okay? Here we go. This is the holistic route. This is a patient, a healthcare practitioner, who said it doesn't work, about using just vitamins and supplements and this and that and the other and oregano oil and whatnot. I'm a healthcare provider and I've recently come across MyMycoLab's information. Thanks so much for the help you provide. I do really appreciate all the great information on the website, especially the YouTube videos, which you're now watching. Knowing that my own family has been exposed, we all just recently had our blood serum tested and we're waiting for those results. As someone who has previously tried the holistic route, I can say for certain that it does not work. I can tell you that as well. Folks, when I see patients, I'm not the first doctor they see. I'm the 10th or 20th or 30th. They've been through taking 20, 30, 40, 50 supplements all at one time. And all these treatments and neural pathway, all this stuff. Remember, in God we trust. You've got to show evidence. And that's what we're going to do tonight, show medical evidence and data. Disease or disorders that have increased since 1990. So for the last 35 years. Look at these numbers. Bipolar disorder in youth, almost 11,000% increase. Autoimmune disorders, 1,600% increase. Autism, almost 2,100 increase. Celiac disease from gluten, 1,100. ADHD, over 800%. Hypothyroidism, 700%. Folks, if you watched any of my videos, you know that these are based all on the exposure of indoor toxigenic molds and their mycotoxins. I want to talk to you about, just briefly, about MTHFR gene variant, because some people swear by this. Gene variants are common and normal. In fact, more people in the United States have one or two copies of the MTHFR C677T variant than don't have it. You may have heard that if you have the MTHFR variant, you should avoid folic acid and you should take other types of folate, such as 5-MTHF. However, this is not true. People with an MTHFR gene variant can process all types of folate, including folic acid. So people with the MTHFR gene variant can process all types of folate, okay? And getting 400 micrograms of folic acid daily can help prevent neural tube defects. Folic acid intake is more important for determining blood folate levels than having an MTHFR variant. When getting the same amount of folic acid, people with the MTHFR genotype have an average amount of folate in the blood that is only slightly lower, 16% lower, than in people with the other genotype, okay? So studies show that getting 400 micrograms, not milligrams, micrograms of folic acid daily can increase that blood folate level regardless of your MTHFR folate. Your folic acid intake is more important. And folks, look at how important that is. Look at your brain health. B9, B12, B6, riboflavin, etc. The B vitamins, the B6, all these at the top, etc. So that's why don't pay attention to that. And if you don't believe me, here's the references that you can look up. These are studies that are published in peer-reviewed medical journals. Now, let's look at some test results of actual patients and help you understand. On the left, you see that this patient has really high IgG antibodies.
Everything.
IgG antibodies indicate that you are having basically, that is a toxic reaction in the body right now. And it's probably, in this situation, I would say it's probably a situation where the patient is colonized from some previous type of, in other words, it's not necessarily that it's it's been there for a long time, but there's a lot of it. The right side, IgE, it takes 30 days to make an IgG antibody. It takes a day to make an IgE. So this person, the IgE indicates, is currently being exposed. So this person has the two things. They have both the issue
backwards
with the problem that they have a lot of these toxic mycotoxins in there, and that they also are currently being exposed. Let me go back to that. And each one of these indicates how much you have of that mycotoxin in your body right now. So this is a person that needs to clean up before they do anything. They need to clean up their environment and then start the treatment. We'll get to treatment a little later. So now this is a pretty strong this one was a pretty strong reaction. Now here is that same patient that finally cleaned up their environment. You notice that the IgEs are way down low. Let me go back. IgEs on the right. You see how high they are? They're much lower. And they're being treated. So look what happened to the IgGs. They got lower too. Now this patient needs some more treatment, obviously. But the first thing was they had to get out of where they were regularly exposed. Here's another case. This person, again, you can see they have IgG indicating a current toxic reaction and IgG indicating that they currently are exposed either at work or in their home. This is after 6 months of treatment and after having remediated their home. You notice the IgE on the right, it's basically back to normal, and these are much less. Let me show it again. You see the treatment? Here we go. And it's the right treatment, not some sort of mixture, etc. I'll get into the treatment later. Here's another patient. And what I can tell you this is that here they have mycotoxins in their blood, IgG antibodies indicating that they have this in their blood right now, and that it's causing a toxic reaction, and they have some exposure. It's not as strong, but still they're having some exposure. It could be at work, it could be at the gym, it could be at home, it could be because they left their car window halfway open and it rained and the carpeting got wet and they forgot about it. And the mold growing in the car. Here's another example. Now, if you look at on the right, you see that this patient has a lot of reaction of IgEs indicating that in that person's environment, again, home or gym or work, they're being exposed on a daily basis currently, right now. And their IgGs are starting to grow. As you can see, these are pretty strong, indicating that they have this much in their body right now, and it's causing a toxic reaction. Here's another patient. They have both. So this person is currently being exposed at home for the IgE, as well as on the IgG side, they have this currently going on. Now, I want to bring up, here's one more patient. Obviously, this one is very exposed wherever, either home or work or wherever, and they have high IgEs, and the IgGs are starting to catch up. Remember, it takes a day to make IgE. It takes 30 days to make IgG. Let me discuss what is called colonization. Colonization is when they start living. Where do they colonize? Basically, the sinuses, and they also do so in the lungs. So here we go. This person has IgG antibodies, and they have some IgE, indicating current exposure. Here's another patient. So as you can see, on the IgEs, they have exposure. Let me ask you something. Let's take some of these that are not that high. Like, for instance, this one right here at the bottom, trichothecene or zearalenone. Would that be considered okay? No. Let me help you understand that. It's not considered okay because a patient, this is a toxin. A toxin is basically a molecule. Mercury is a molecule. Mercury is a molecule. Mycotoxins are a molecule. Other things like viruses, like bacteria, etc., are living organisms with cell walls. So when you have an IgG reaction to those kind of things, that leaves a memory, and then years later, you will still have the IgG antibody there, although you're not sick anymore. For example, if you had chickenpox as a child, you still have the IgG antibody to chickenpox. Not so with toxins, because they're not alive. They don't have cell walls. They're just a molecule. When you have IgG antibodies, it means right now, currently going on in the body. Not that sometime in the past, in childhood or wherever. So this person, you don't want any one of these to be all the way, and that this is just a little bit like at the bottom, etc. Let me explain that to you up here. Here's what it looks like when a patient doesn't have any. Look at the IgE. It's almost, you might see a little hair here and there, but it's basically all gone. So this is what we mean by that. Here's another patient. This patient has both IgE on the IgE, and I'm sorry, this is IgG, but they put IgE and IgE on the right. This person is currently being exposed and starting to develop more and more IgGs. This person is the same way. The IgEs indicate that right now they're being exposed because it takes IgE a day to form, and slowly these IgGs are going to creep up because they take longer to form. Here's another patient. You see these, she has pretty strong reactions to the IgGs, and she has reactions to the IgEs. This is a person whose environment contains toxigenic molds and their mycotoxins, and is currently in a toxic reaction. And here's a person who, on the right, you see more IgEs indicating they're currently exposed, and on the left, the IgG antibodies indicate that they're slowly going to increase and catch up with the IgEs. One more, I think. You see how low the IgGs are? That's because this person is now being exposed. They haven't had long enough to be have higher IgGs. Eventually, they'll have higher IgGs the longer they stay in that environment. The IgEs on the right indicate, yeah, they're in that environment right now. Folks, I get told ERMI test. Look at the date on the bottom right-hand corner, August 22, 2013, 12 years ago. It's not the right test. People are trying to sell this test all over the internet. I do not recommend it. Let's look on the latest study on urine testing for mycotoxins. They looked at, these authors published this 2 years and 3 months ago. And basically, they said that the variability of mycotoxin concentration in urine, it's variable, and volume based on daily intake demands, it says that urine sampling should be done at several time points during the day, not just once and send it in to one of the 3 PP labs. But remember, they have to normalize the urine with creatinine concentration. And because every individual's creatinine concentration is different because of such things as are they male or female? How old are they? What's their diet? What have they eaten that day, and what beverages have they had, or what haven't they eaten? And their muscle mass. All those can influence creatinine secretion. So they looked at the blood test that MyMycoLab does, which is known as an ELISA test. Significant accuracy, precision, and specificity. So people, when you're taken in by the marketing on the website of this or that or the other lab, ask them for published studies. Don't be taken in by the slick commercial. Do you know how many studies have been done on the ELISA testing for mycotoxins? 1,124. Why do you think university medical centers have done for the last 30 years and continue to do studies using this, not the urine? Here's another urine thing. Okay, limitation of organic acid tests, the OAT, and gut health. Several popular organic acid tests claim to detect imbalances in gut bacteria and fungi, but most of the microbial markers on these tests do not measure what they claim to do. So read the study. Here's another one. Many labs focus on the level of chemicals measured in urine, but this is only an indication of the chemicals that have already passed out of the body. They should measure the immune response to the chemicals in the body, not what's left the body. So look for the body burden of chemicals, not the chemicals coming out of my urine. This is from Dr. Vijdani from a year and 2 months ago. And that includes mycotoxin antibody or mycotoxin in urine. Let's look at this study published 5 years ago on the GI map. Look at what turned out to be in this research article. The specificity of the GI map is 26%. That means that 74% doesn't have specificity. Well, that's not what I want for my patients. So what is the most precise and accurate test for mycotoxins? You saw it here in this significant accuracy, precision, and specificity. Yes, folks, this test, MyMycoLab's test, 14 different mycotoxins, and you get IgG antibodies and IgE. That means 28 test results. And then, as a healthcare practitioner, you can always have a Zoom consultation with me to go over the test results. Let's talk about the sensitive patient for a moment. Too many supplements, and then they are so sensitive they can't take anything. Then there's those that have mast cell activation syndrome because they have high levels of IgE antibodies to mycotoxins. And very basically, when you have the wrong diagnosis and the wrong treatment, the patient continues sick and gets more sensitive and becomes chronically ill. If you have the right diagnosis, you have the right treatment, patient gets well and no longer sensitive. Now, here's a study that came out in November 2024, or I'm sorry, 2023. So a year and 2 months ago. They took 60 dietary supplements, the most popular purchased ones, and took them to the lab to see what's in the bottle from what it said on the label. 11% actually contain an accurate amount of the key ingredients listed on the label. 40% did not contain any detectable amount of the ingredients at all. 40%. So you're buying this supplement from this lab and you're telling the patient to take it, and then that supplement from that lab and this from the third, etc. And you don't know which one of these categories it fits. Now, to get the specific 8 supplements, and it's only 8, it's not 20 or 30 or 40, and the correct dosage, go to detoxpure.com. Let me tell you what happened. I recommended these 8, very specific, from very specific different kinds of labs at very specific dosages, and the patients had a problem in getting to them because they've got brain fog and so on and so forth. And they'd go to one site and they'd email me and say, "Doc, is it this one or that one? I'm confused." And then they have to go to another website, et cetera, et cetera. Well, in Las Vegas, and at the A4M conference, these people came to me and says, "Tell you what, we'll get that from these other laboratories, put a new label on them, and we'll sell the box with the 8 specific supplements with all explanations on how they should be taken." I said, "Thank you. I needed that." And it cut down quite nicely on the amount of emails I got. So you click on this. I know that for healthcare professionals, there's a discount. So again, they do it all. They package it up, and you get one package, and it's 2 months worth of supplements. Here's the 5 parts to the successful treatment. Today, I had a healthcare professional go over a young man who had his first test in 23, then another one in early 24, and then one in late 2024. Still sick, still elevated. Well, they've given him all kinds of stuff, and they've given him binders and this supplement and that supplement, etc. I'm sorry, that's not how it works. So the first rule, get the patient out to where the toxic molds are, okay? Or get it remediated. Second, use the correct antifungal, itraconazole. Third, take 8 specific nutrition supplements at specific dosages. These patients will need an anti-inflammatory and low histamine nutrition. And then retest in 6 months. Why 6 months? Because that's about how long it takes for most people to get well on this treatment. Not 2 years, 3 years. So the treatment, first and foremost, it's the first rule of toxicology. Get the patient away from the toxin and the toxin away from the patient. And second, simultaneously build back up the immune system while giving an antifungal. People say, "Oh my God, I read that somewhere on the internet said that itraconazole is going to make your eyeballs fall out, all your hair fall out, it's going to totally destroy your liver and all kinds of things." Again, in God we trust, everyone else has to show data. This is data. Itraconazole from the journal Expert Opinion in Pharmacotherapy. Itraconazole, look at that. The last two lines, itraconazole has been well tolerated with doses of up to 400 milligrams being generally free of adverse effects. All right. And then I get those, oh, my doctor treated me with diflucan, which is fluconazole. That's great because fluconazole only kills single cell molds. That's yeasts, baker's yeasts, brewer's yeast, candida. It does nothing for aspergillus, stachybotrys, penicillium, cladosporium, all the others that are basically all multicellular molds. So use itraconazole because it kills both the single cell and the multiple cell. Makes sense. Myth. Mycotoxins colonize the gut, so you have to pull them out with binders. Pull, etc. Again, in God we trust. Show me the studies, show me the data. There is one study, and this was published, and it says binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the bloodstream. And these are the ones included: kaolinite, clays, activated charcoal, zeolite, bentonite, etc. They're neutralizing an aflatoxin. Aflatoxin is not an indoor mold. It's an outdoor mold. It grows on certain crops in Africa and Western rural China. They are ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micro elements. So please, folks, don't get into that myth. Here's another study. Some physical strategies, such as application of adsorption agents, binders, presented no sufficient effect against mycotoxins. There you go. For those of you who give binders. And also, binders interfere with these medications, and it doesn't matter if you give the binder hours apart from these medications. Look at this. What about if this person is taking thyroid medication or hormones, or is a diabetic or has high blood pressure? Okay. And you have to avoid them in these patients. No. In our clinic, we give them to everybody. Well, that's why they're not getting well. That's why I get 50 emails every day, 7 days a week, 365 days a year. I've been on all these binders, etc. Go to my website, read what patients actually write to me, not what I say. If you want any of these studies, mycotoxins, the brain, the gut, and misconceptions, written with Dr. Weinstock, with Dr. Watson, molds, mycotoxins, and their effect on children. How about Lyme disease and mycotoxins? How do you tell between the two? And then environmental triggers and autoimmunity, published in Autoimmune Diseases. So if you're interested, there's my email address. Now, let me see if you have any questions. Usually folks do. All right. What about getting the folic acid into the brain? You just read the studies. Show me that they don't, send me a study that says it doesn't work. Okay? So, and then, there's those people that go to conferences, hear this doctor saying this and this, that doctor saying that and that, and they embrace it all. They think it's great, and they start using all kinds of stuff that doesn't work. Does itraconazole treatment reduce both? Yes, both IgG. The IgG is high and the IgE is low. That is a colonization. Correct. Very good. Diana, in the 8-10 week mark of treatment, what can you expect to feel? as the first improvement. It depends on each patient. Some patients, they say, I'm sleeping better. Others say, I don't have any cough anymore. Others say, my brain fog is getting better. So it all depends on that. Please interpret how to improve IgG is high and the IgE is only slightly elevated. It means what it was said before, colonization. And then, what's the sense and specs of the ELISA test for IgG and IgE in MyMycoLab? I'd be happy to send that to you. It's basically, because it's done every year, and it was just done 2 or 3 weeks ago because it's repeated every year. It's the IgG is 100%. The IgE is in the high 80s and low 90s. Diana, over the summer, my husband started getting mild poison ivy looking kind of rashes. He tested positive. 3 weeks into Spornox, he had a major flare of the rash and it appeared in 6 different parts of his body. Well, I think fungus got into hair follicles, according to the dermatologist. Is he taking everything or just itraconazole? Is he out of the environment or not? The treatment is a whole set of things. It's not just part. It's like sitting down to a meal and they just give you a spoon. Well, that's great for a soup. But what if you've got to eat other things? You need a knife and a fork, etc. What if the immune system is not mounting an antibody response? When the immune system stops making antibodies, you die from just about anything. If a flea bites you, you will die. If I'm living in a clean environment but visit my mom who has mold at her home, I stay with her at her home every weekend. Will I get better? Well, if you keep exposed, let's change from mycotoxin to mercury. And you go back to mercury every weekend, are exposed again and again to mercury. Will you get better? No. How does mold affect weight loss, resistance, and hormone imbalance? Well, it's not mold, it's mycotoxins. Mycotoxins change your hormones. What do I mean by change your hormones? Thyroid. Hashimoto's thyroiditis is a known, mycotoxins are known to cause Hashimoto's thyroiditis. And imbalances between progesterone and estrogen, and in men, it lowers testosterone. Here's another question. If you don't follow an anti-inflammatory diet, will symptoms not improve despite a mold-free environment and Spornox? Again, it's one complete set of things. If you leave, it's a four-legged table. Remove one leg. What's going to happen to the table? Can the mycotoxins mold cause fibrosis of the lungs? Yes, it causes fibrosis of the lung and fibrosis of the kidneys, either one. What are the possible lung symptoms? Tightness of the chest, chronic light cough, like a pressure feeling on the chest, etc. Beyond oral itraconazole, is there any specific treatment for the lungs? Yes, all that I put down earlier, those parts. Look up aspergillosis. Yes, pulmonary aspergillosis is not uncommon. Detox Pure does not have practitioner accounts available yet, as per email to me. They should by the beginning of next week. I told them that make sure they do. Do mycotoxins cause low COT and anion gap in blood work? It depends on each patient. It depends if your lungs are affected or not. How does a client get itraconazole if we don't prescribe? You have to find someone who can prescribe. Usually you make an association between someone who can prescribe and make an arrangement. That's what a lot of people have done. Do mycotoxins trigger vestibular migraines? Yes, not only that, but they affect the acoustic nerve. and you can feel vibrations. And this was in a study published in 1992 by yours truly. I was younger then. What is the longest, safest duration to take itraconazole? Example, a patient starts taking the antifungal before all remediation is done. That's not recommended at all. Why take something when you're being exposed every day to more and more mold spores, and mycotoxins? You shouldn't do that. Can you comment on the use of cholestyramine, the idea that toxins are in the bile? It's a myth. There's no studies, none. There's over 28 million studies in the National Library of Medicine. I've published over 100. There's no studies that there's anything in the bile or that cholestyramine does anything to those mycotoxins. I just showed you two studies, two published studies. Show me a published study that those things work. My son had the mycotoxin test in May of last year. Levels show colors yellow, orange, and red. Notice newer results, color shading is only red. Well, they changed the shading because too many people thought that yellow meant it was okay. I treated patients for 6 months. Most of IgG has increased, most of IgG has decreased. Well, this patient, if you have that patient, the first thing I would ask is, what else are you giving it? Okay, mast cell stabilization supplements and medication. Is this change suggestive of current? If you're going to add all kinds of other things, you will not be successful at getting this patient normalized again. What about CSM? Sorry, that doesn't, there's no evidence that that works. If my son, 22, has low cholesterol, can he still take it? Take what? Itraconazole, yes. If you have MCEs, can you start low and slope? Yes. Rash is common when starting ITRA. On the contrary, for example, mycotoxins can cause everything from eczema to psoriasis. In the beginning, you're getting rid of the toxins through the skin. That's one way to get rid of it, through the sweat pores. So it can cause a mild rash at times. Many suffer from severe anxiety. Yes. Oh, yeah. And what causes anxiety and depression? If you look at my questionnaire, it's one of the first few questions, because mycotoxins are known to cause anxiety and are known to cause depression. As a matter of fact, the chairman of the Department of Psychiatry here in the United States of a major medical school, when the antidepressant medication doesn't work in his patients, he does the MyMycotoxin test, treats them for mycotoxins, and the depression goes away. So are there any anti-anxiety medications? Sorry, How do you bridge the gap to heal? That's the key factor. You have to get them off, and they have to be off for 3 to 4 days before you start itraconazole. And in a relatively short time, many patients say that they will get better. If there are toxins, then it doesn't make sense that itraconazole will kill it. Well, let me help you understand. If you know about molds, toxigenic molds produce spores, and the spores carry mycotoxins. So you kill the spore with itraconazole, and there's no more mycotoxin. And yes, the itraconazole kills the molds in the body that are producing the mycotoxins. Oh, here's someone who says Detox Pure gives a 17% discount for healthcare professionals. Thank you. I didn't know that. I have 5 patients who developed muscle soreness while taking itraconazole. What else were they taking? Because if they're just taking itraconazole and not the other parts of the treatment, it's not going to work. Another patient developed pedal edema. Most recently, another patient developed dizziness. Okay, well, are they taking just that? Are they still being exposed? Are they on other medications and other supplements? Those are the things that make things worse. Do you suggest any other fungal options for mycotoxin treatment? I have patients who have major medication interactions with itraconazole. Any medication that, okay, the other one I use at times is voriconazole, but it'll interact, okay? And also, remember, folks, it's all together. It's not just itraconazole, and I showed you that in the slides. Um, is there an association between mycotoxins and lymphoma? Yes. Why? And this has been made evident in women with breast implants because the implants contain fungi. And women with breast implants are known to develop a certain type of a very specific type of lymphoma. Mycotoxins affect the bone marrow where cells are made. So yes, they cause that. Can mycotoxins cause laryngopharyngeal reflux or bile acid diarrhea? First, I would ask you, how do you know it's a bile acid diarrhea? I hope you didn't use GI map. Um, and the reflux is possibly due to demyelination, which we know the first place mycotoxins go is the brain, and the first thing they do in the brain is demyelination. Folks, please watch my other webinars where I discuss all these things. I am scared to take, as Stephen Johnson from another black box had Lyme. Okay, well, if you're afraid, I'm sorry. I mean, after 17,000 patients, you don't think I've treated all kinds of situations over the last 30 some odd years? I would tell you if there's a difficulty with that. For the 8 to 10 week mark, I guess I don't quite know what to expect, as I've had issues of getting away from exposure in the past. Well, again, you have to be away from the exposure. You have to take itraconazole. You have to take the 8 supplements. You have to be on a anti-inflammatory, low histamine diet. It's not just one thing. It's all that. That's a four-legged table. And yes, people catch all kinds of flus and things like that. But again, after 17,000 patients, over 100 published studies, okay? Positive only IgG house is clear as I can tell. Safe to assume exposure from childhood home. Anything's possible. Dietary cholestyramine reduces ochratoxin in the rat. Okay, unfortunately, I treat humans, and so I'm looking for human studies because we know there's studies on rats, there's studies on rabbits, on sheep, on mice, on chickens, on piglets. I need to see in humans. Used to recommend omega Q plus MAC, but this is on the link. That's correct because the person um, um, who headed was Dr. Steve Sinatra for the omega Q plus MAX, and unfortunately, he died. He passed away, so I cannot vouch for it anymore. Once the spores stop making the mycotoxins, how do you get rid of the remaining toxins? This is because you're away from it, because of the itraconazole and the 8 specific supplements and the diet. All those will help sweep them out. Itraconazole, please watch my other webinars. They're on MyMycoLab's YouTube channel. There's 60 of them or more. It's 100 milligrams twice a day in adults, and that's for 6 months. My sister has MS and terrible heartburn reflux. She was definitely mold exposed. Well, studies done at Rutgers University School of Medicine in New Jersey showed that patients with MS have mycotoxin antibodies in their blood. And I show that in several of my webinars that are on the YouTube channel, especially the ones on the brain. I've had many patients come to see me and with MS, they're in wheelchairs, they're very affected, and a year later, they're playing volleyball or tennis. What is the number one thing? It's not one thing, it's the combination. Okay. And a group of us published a study. It's actually a chapter in a medical textbook on demyelination, and it was published in 2004. We've published a whole bunch of studies since then, because that was 20 years ago, and showing how this demyelination occurs and what to do about it. House was remediated and retested, took the wrong treatment, and haven't gotten better. Thus wasn't treated. Recently took the MyMycoLab test and shows both IgG and IgE. Could these levels be left from when I was exposed and not treated? No, it means if you still have IgE, it means it's in your environment. But remember, that could be from the gym, work. Maybe you left a window in your car half open and it rained and the carpeting in the car got wet and there's mold in your car. It may not always be the house. Why low antihistamine diet? Because you get stimulated by IgE with histamine. So it's for everybody, not only a certain group of patients. I've done over 50 plus tests with your lab, and many of the patients see improvement in about 3 to 4 weeks with a recommended treatment. Wonderful. Congratulations. I'm happy to hear that. Does the patient need to be on dairy-free, gluten-free diet? Yes. It's and no artificial anything, I might add. Does the level of antibody depend on duration of exposure, amount of mycotoxins in the body, or individual immune system reactivity? All three. Can mycotoxins cause increased thick sebum production? Yes. How will you feel when hormones are shifting back to normal? I'm at 11 weeks into Fornox, and I'm proud of some improvement. I still have a difficulty with menstruation, with hot and cold flashes, extreme fatigue. Some people, it's faster. Some people, it's lower. I don't know what your age is. I mean, all I know is obviously you're a female. It takes having some more information to be able to help a person like that. Can IgB be elevated due to a response from mycotoxins being produced internally due to colonization? No, they're completely different reactions. They're immune reactions. Is it safe to be on nitroconazole and Skyrizi at the same time? I wouldn't be, no. All righty, folks. Answered a lot of questions. I hope you've heard a lot. Please go to andrewcampbellmd.com.